got over 3,000 cases of chlamydia. Have you ever heard about like canceling the prom? This is not the way to use public health data to inform policy. Something's wrong here. So, we have competent disease reporting systems. We accurately count these things. We know about the number of cases of malaria and dengue. Even though they're tropical diseases, physicians can find them. So these are good systems, and we don't use them. We don't ever talk about these systems and using these data to talk about climate change. I've never seen it. Now, what about other things? Well, linking pesticide exposures to health is really hard. We don't even know what we use in the way of pesticides. I have no idea. No idea. You can't find that data. It does not exist. So the only way we're going to know is if a person who is exposed goes to their doctor admits they don't know anything and calls poison control to get some advice. And Poison Control Center will track that. But if all those things don't happen, we won't even know whether somebody got poisoned from a pesticide. And that probably will only happen in younger people or women because old grouchy guys won't go to the doctors because I'm fine, damn it. I don't even know how we track these things, but things like what happens when you cancel sporting events. But I have the feeling they're important. So we know that crime rates go up in heat waves, right? So there are these indirect effects. We don't even have the slightest idea about how to track them. We know that more extreme heat will have more air quality alert days. It'll have all sorts of impacts. Harry talked about deaths due to heat. In Chicago, 300 to 500 direct deaths, maybe as many as 700 excess deaths where heat was a secondary effect. This is possible. But what are the factors that were protective? Well, living in air conditioning. But number two, close to that, was answering yes to the question, I have a good friend or relative living in Chicago. And that means that unless we can track vulnerable populations, we're not going to be able to get to these people. So if we're going to have some impact on heat and health, we're going to have to know how to get to shut-ins and bedridden people who, like me, are grouchy and just want to be left alone. Those are the people that die. And how do you find them? So these kinds of things are not just environmental problems. These are social problems. And to look at them strictly in a scientific way is my So that's my conclusion. The power of this, of groups like commissions, of groups like Metcalf, or like this collection of journalists, is not because you've got one or two experts, people that know what they're doing and know what to do. We've got plenty of people who know what they're doing and know what to do, but that didn't stop them from approving some stupid solution to the problem of Metcalf Rhode or beach erosion or anything else. The power to solve those problems is going to be the power of bringing lots of people together and finding a common solution that just sort of makes sense to the common man.